Namaste everyone, I am Dr. Monalisha Sahu, Associate Professor and Head of the Department of Occupational Health at All India Institute of Hygiene and Public Health, Kolkata at Ministry of Health and Family Welfare, Government of India. I also additionally serve as core committee member of National Human Rights Commission and as member secretary and presiding officer for two of the ICC committees of Government of India. Today, I stand before you with immense pride and a sense of deep urgency to present my DEAN project, WINGS, that is, Women's Integration and Growth in a Safe Healthcare Setting. So you may ask why this project? Let me share with you one tragic moment which shook me to the core. On August 8, 2024, a tragedy struck at a major hospital in Kolkata. A 31-year-old female trainee doctor was brutally raped and murdered during her night shift. It wasn't just a crime against a doctor, it was a savage violation against a woman. This horrific incident ignited something within me. How can we speak of empowering women leaders in healthcare when we fail to provide them with the most basic and fundamental right, that is safety in the workplace? This question drove me to refocus on my leadership journey, and from this, WINGS was born with mission to bridge the gap between posh policies and real protection. Despite comprising 70% of the healthcare workforce, women face constant threats from crude comments to harassment and violence. Workplace violence is a structural issue rooted in gendered power dynamics. It is often buried beneath the surface like the unseen base of an iceberg. Our theory of change is that by identifying POSH implementation gaps, delivering targeted interventions and trainings, and advocating for policy improvements, we may aim to reduce workplace harassment, increase compliance, and foster a culture of safety and respect for women in healthcare. While identifying the barriers, the voices we heard through the IDIs were of fear, lack of trust, lack of knowledge, shame, stigma, and helplessness. It fueled our mission to break the silence and empower women to report without fear of retaliation. We started working on enhancing workplace safety through targeted strategies, displaying internal complaints committee details via awareness posters and installing CCTV at key critical locations to foster a secure environment, conducting POSH training for faculties, staffs, and students to strengthen compliance and build a culture of accountability. Fostering a culture of safety, we have engaged staff through impactful competitions and themes like Workplace Safety for Healthcare Workers on Institute Foundation Day. Events like International Day for Elimination of Violence Against Women amplified solidarity and commitment to safer workplaces. Early impacts are evident as awareness of POSH policies grows across various knowledge domains. Participants share that now they feel more confident about reporting harassment. The sessions have seemed to benefit all the genders. Participants now recognize the importance of speaking up, with one stating, "The intervention session was eye-opening. I realized that silence enables harassment and I am now ready to support my colleagues." Another person told, "I used to worry about false complaint when reprimanding female employees, but now I get what is covered under POSH, which helps me avoid any misunderstanding." Another person again shared, "I have come to realize that gendered remarks are just not cool. But just policies alone cannot create change. Trust can." Our next step is to co-develop solutions with employers and employees because a safe culture grows where trust thrives. WINGS is more than just a project. It is the foundation of a movement. Through strategic alliances, male allyship, and a clear action roadmap, we envision replicating WINGS across healthcare institutions, making safety a norm, not an option. We dream of expanding it with a WINGS toolkit to all healthcare workers nationwide, even to the unorganized sector. My journey with WomenLift Health has been nothing short of transformative. It has deepened my self-awareness, refined my leadership, and elevated my voice in ways I never imagined. Through this remarkable platform, I have embraced authentic, inclusive, strategic, and impactful leadership, channeling my vision into action through the WINGS project, a promise to every woman who heals, serves, and leads. This impact is powered by the dedicated efforts of my fabulous team of passionate individuals united by a shared vision of a safer tomorrow. Finally, with deepest gratitude, I extend my heartfelt appreciation to the entire Women Lift Health team for amplifying my voice with their unwavering support. My sincere thanks to my esteemed mentor, Dr. Parvinder Mani, my incredible coach, Abhilasha Jha, and my inspiring WLH cohort members for their constant encouragement. As Helen Keller once said, alone we can do so little, together we can do so much. Together we shatter the silence, together we create safe spaces, together we give wings to the change. Thank you.